The heart extends in the middle chest part and the left chest part. I will talk about what kind of blood passes through the atrium and ventricles of the heart. Blood containing lots of oxygen by going through both lungs goes into the left atrium. Blood in the left atrium goes into the left ventricle. The left atrium and left ventricle are inner spaces for blood to pass. The wall of the left ventricle is thicker than the wall of the left atrium. This is because the left atrium sends blood to only the left ventricle, but the left ventricle has to send blood to the entire body. When the left ventricle contracts, it sends blood to the whole body and the blood pressure becomes higher. We call this blood pressure systolic blood pressure. In contrast, we call the blood pressure when the left ventricle relaxes the diastolic blood pressure. The normal systolic blood pressure is 120, and the normal diastolic blood pressure is 80. Memorize 120 and 80. The blood from the left ventricle passes through an artery and goes to the whole body. It passes the ascending aorta, aortic arch, thoracic aorta, and abdominal aorta subsequently. The subclavian artery becomes the axillary artery, then the brachial artery, which divides into the ulnar artery and radial artery. The abdominal aorta divides into two common iliac arteries. The common iliac artery is an artery that supplies the pelvis, perineum, and lower limbs. Blood that gave away lots of oxygen throughout the entire body passes through the superior vena cava and inferior vena cava and goes into the right atrium. The internal jugular artery and subclavian vein meet to form the brachiocephalic vein, and two brachiocephalic veins meet to form the superior vena cava. Also, two common iliac veins meet and form the inferior vena cava. The superior vena cava is the place where blood from the upper body meets, and the inferior vena cava is the place where blood from the lower body meets. Arteries and veins go along a similar path, and their names are similar also. An artery and vein can be seen as pairs. The blood in the right atrium passes through the right ventricle and left pulmonary artery and goes into the lung. The pulmonary trunk divides into two, and each artery goes to the right lung and left lung. Only blood with low oxygen passes through the pulmonary arteries, but they are still called arteries because they go out of the heart. You can see that the right ventricle's wall is thicker than that of the right atrium. However, the wall of the right ventricle is not as thick as the wall of the left ventricle.